and medical supplies, as well as matters pertaining to human resources. Accordingly, we interacted with the management, staff, labor unions, and patients at the various facilities in the Eastern Cape, Gauteng, Limpopo, Mpumalanga, and KwaZulu-Natal. The in-loco inspections were followed by in-depth investigation in pursuit of issues that came up during interactions with stakeholders and as a result of our observations. To date, we have issued 2 reports. The one was in respect of the conditions of the Eastern Cape hospitals. The other was an observation report following a tour of Gauteng hospitals, where we brought to the attention of authorities quick wins that in the meantime they can implement so that those can be impactful. Today we release our findings as regards the state of public hospitals in Limpopo, Mpumalanga, KwaZulu-Natal, and Gauteng. Advocate Galega will deal with KwaZulu-Natal and Gauteng reports. Those reports detail our findings in respect of conditions at Christ the King District Hospital in Iklopo, Ridgevlei District Hospital in Umzimkhulu, Mbongolwane District Hospital in Eshowe, and KwaMagwaza District Hospital in Melmoth in KwaZulu-Natal. They also deal with our findings concerning Jubilee District Hospital, Dr. George Mukari Academic Hospital, Steve Biko Academic Hospital, Chris Hani Paraguay Academic Hospital, Lillian Ngoyi Community Health Center, and Charlotte Maxeke Johannesburg Academic Hospital in Gauteng. I will then deal with conditions at the 2 hospitals that we visited in Limpopo and Mpumalanga. That is WF Nobel Hospital outside Polokwane and Temba Hospital in Bokweni, respectively. I'll now hand over to the Deputy Public Protector to deal with the reports of KwaZulu-Natal and Gauteng Department of Health, respectively. DPP.
Thank you, Public Protector. A very good afternoon, Program Director, Public Protector, the CEO of Public Protector South Africa, all managers present here of Public Protector South Africa, members of the media, the public at large, ladies and gentlemen. Looking into the KwaZulu-Natal Department of Health report number 50 of 2021-2022, the Public Protector launched an own initiative investigation into the provision and administration of health services at public hospitals in KwaZulu-Natal. This followed widespread media reports about the poor provision and administration of health care services at public hospitals in the country at large. The investigation team visited Christ the King District Hospital in Limpopo, Ridgevlei District Hospital in Umzimkhulu, Mbongolwane District Hospital in Eshowe, and KwaMagwaza District Hospital in Melmoth on the 6th and 7th of October, respectively, of 2020, and conducted site inspections. The inspections included indiscriminate interviews with staff members, union representatives, and the patients themselves. Based on the analysis of the allegations and information obtained, the Public Protector focused the investigation on whether the provision and administration of healthcare services by the KwaZulu-Natal Department of Health at all 4 hospitals accords with the obligations imposed by the Constitution and the law, and if not, whether such failure amounts to improper conduct and maladministration. The investigation revealed that the provision and administration of healthcare services by the department at all 4 hospitals did not accord with the obligations imposed by the Constitution and the law. At the Christ the King Hospital, it was observed that there were systemic deficiencies such as staff shortages, poor physical infrastructure, such as dilapidated buildings, lack of laundry services, poor information technology connectivity as detailed in evidence in the report. Regarding the Rietvlei District Hospital, it was observed that there were systemic deficiencies such as staff shortages, poor information technology connectivity as detailed in evidence in our report. The same systemic deficiencies were echoed in submissions by the hospital management and union representatives that were engaged during interaction with the investigation team. In respect of Mbongolwane District Hospital, it was observed that there were systemic deficiencies as well, such as staff shortages, poor physical infrastructure, such as dilapidated buildings, lack of laundry services, and also poor information technology connectivity challenges as detailed in evidence in the report. Lastly, as regards to KwaMagwaza District Hospital, it was observed that there were systemic deficiencies as well, such as staff shortages, poor physical infrastructure, such as severely dilapidated buildings, lack of laundry services, and poor information technology connectivity challenges as detailed in the evidence. The same systemic deficiencies across the 4 facilities were echoed in submissions by hospital and union representatives that were engaged during interaction with the investigation team. The department did not dispute the observation made and findings as per the correspondences received from the Office of the Head of Department dated the 16th of March 2021 and 21 May 2021 respectively. The department has failed to ensure appropriate conditions for the enjoyment, delivery, and access to adequate as well as effective healthcare services for the rural communities of Ikopo, Umzimkhulu, Eshowe, Mtonjaneni, as well as the surrounding areas being served by these hospitals. Such failure amounts to the contravention of Section 195, subsection 1, E and F of the Constitution, Sections 237 of the Constitution, Sections 25, subsection 1 and subsection 2, and Section 27, subsection 1 of the National Healthcare Act, as well as the regulations as shown in evidence in the reports. Accordingly, the conduct of the department constitutes improper conduct as envisaged in Section 182, subsection 1 of the Constitution, and maladministration in terms of Section 6, subsection 4A(I) of the Public Protector Act. However, the Public Protector notes and acknowledges the challenges and constraints faced by the department, as well as the context within which healthcare services are delivered in the provinces of KwaZulu-Natal. Based on the action plan the department submitted to the Public Protector, detailing how the shortcomings and deficiencies in each of the 4 hospitals will be addressed and taken into consideration, submissions made by the Provincial Department of Public Works and Human Settlement, the Public Protector has taken appropriate remedial action in pursuit of Section 182, subsection 1C of the Constitution to aim at remedying the deficiencies. The details thereof are in the full report. In addition, the matter was also referred to the MEC of Public Works and Human Settlement for consideration of technical infrastructural support and renovation needs as enjoyed by Section 13, subsection 1D of the Government Immovable Assets Management Act of 2007 in relation to the identified hospitals and other public healthcare facilities in the province of KwaZulu-Natal. The matter is also referred to the head of the Provincial Treasury for consideration of financial support and oversight where it appears necessary in relation to the identified hospitals and other public healthcare facilities in the province of KwaZulu-Natal. Lastly, the matter has also been referred to the President of the Republic in consultation with the Minister of Finance and the Minister of Health to submit the projection plan regarding when the moratorium measures on the employment of non-exempted staff are likely to end. Further, to submit a plan regarding measures to ensure that non-filling of non-exempted posts does not impede adequate provision of healthcare services. The above referrals are being made in terms of Section 6, subsection 4C II of the Public Protector Act. I move on to the Gauteng Department of Health report number 71 of 2021-2022. The Office of the Public Protector investigated the administration, management, and the responsiveness of the Gauteng hospitals to the COVID-19 pandemic. The investigation commenced on 19 August 2020 during site inspections of healthcare facilities in the province to determine their state of readiness to cope with the pandemic. The inspection entailed random interviews with medical and nursing staff, organized labor, and patients. From 18 to 20 August 2020, 6 facilities were visited, namely the Jubilee District Hospital, Chris Hani Baragwanath Academic Hospital, Dr. George Mukhari Academic Hospital, Steve Biko Academic Hospital, Lillian Ngoyi Community Healthcare, as well as Charlotte Maxeke Johannesburg Academic Hospital. Having analyzed the observations, we investigated whether the allegations of administrative deficiencies at the Gauteng Department of Health led to systemic challenges in the delivery of primary healthcare services at all 6 hospitals, and if so, whether such failure amounts to improper conduct and or maladministration. The investigation confirmed that indeed there are administrative deficiencies at the Provincial Department of Health that led to systemic challenges in the delivery of primary healthcare services at all 6 hospitals that were visited. I'll briefly go through each hospital, highlighting the deficiencies that we came across. Jubilee District Hospital. The allegation by the hospital CEO, Dr. Modise, that he was not consulted with regard to the construction of the alternative building technology is unsubstantiated, as the COVID-19 readiness draft infrastructure assessment report by the Gauteng Department of Health indicates that a needs analysis was conducted at the Jubilee Hospital on 6 April 2020, and Dr. Modise was present. Although Dr. Modise was consulted, the construction of the ABT did not necessarily satisfy the needs of the hospital in respect of adding or enhancing the intensive care unit capacity and theatre equipment, which was the hospital's view, which was not incorporated in the structure. The allegation that the kitchen is small and not conducive to curb the spread of the virus is substantiated. However, it was established that there was not much that the hospital could have done, as this is a structural issue. The hospital management communicated with staff regularly by way of memoranda and COVID-19 updates, advising them to self-regulate by adhering to social distancing, to not sit together to have a meal, to always wash their hands with soap and water in order to mitigate the risk of infection. There were systemic deficiencies, such as delays in the distribution of PPE to the hospitals, shortage of certain items of PPE, such as the N95 mask, delays in the testing around time. However, those improved over time, as shown in the evidence in the report. Personnel Circular 14 of 2020 permitted staff members who contracted COVID-19 to be granted special leave upon application, and the hospital could not provide the evidence that they granted such applications to staff as stipulated in the circular who had applied to counter the allegations raised by organized labor. In terms of the COVID-19 disease, Infection Prevention and Control Guidelines, version 2 dated 21 May 2020, overalls or gowns may be reused if there is an acute shortage of PPE during the COVID-19 outbreak. As a result, overalls or gowns may be reused if they are not visibly contaminated or when providing care to same patients. The allegation that Jubilee Hospital did not have a dedicated vehicle to collect PPEs at the warehouse is unsubstantiated. It was established that the hospital had a sufficient fleet vehicles and the hospital had an option of requesting additional fleet vehicles from the provincial department if required. It was established that there were challenges with centralization of procurement of PPE as shown by the delays in the supply and delivery of the PPE. All donations by the delays in the supply and delivery of the PPE. And all donations received by the hospital are required to be registered and declared with the National Treasury. The evidence at the PPSA's disposal indicates that the hospital did not declare such donations as required by the Treasury regulations. Moving over to the Dr. George Mukhwebane Academic Hospital. At this facility, there were systemic deficiencies such as the failure to remunerate contracted COVID-19 healthcare workers and the late creation of positions, which was acknowledged by Dr. Lebete. There were delays in the procurement of medical equipment for the hospital, which was requested more than 3 years ago. It was established that the delays in the procurement of medical equipment was as a result of limited delegation to the CEO, as well as centralization of procurement and the ineffective and efficient supply chain management unit within the provincial department. Evidence at our disposal reveal that systemic deficiencies such as the failure by the hospital to secure and dispose of medical waste in terms of the applicable provisions of the National Health Care Act is substantiated. There was lack of contract management in respect of waste disposal, which likely resulted in the service provider benefiting for 4 years without a competitive bidding process being undertaken. There was a failure to convene regular risk management meetings, which would assist the hospital, and more so during a pandemic, in order to prepare for and mitigate emerging risks. Moving over to the Steve Ligo Academic Hospital. Regarding this hospital, evidence in our possession in respect of the conditions assessment report from the Department of Infrastructure Development, the DID in short, confirmed that the roof of the facility leaks, but that the DID does conduct routine maintenance. Evidence in the Public Protector's possession revealed systemic deficiencies such as the failure to convene risk management meetings during the first quarter of the 2020-2021 financial year. Further, that the risk management committee was not comprised of both management and external members with the necessary blend of skills, competencies, and attributes. Neither was the chairperson of the risk committee an external person as recommended by Chapter 13, subsection 24, subsection 3 of the Public Sector Management Framework Act. Evidence further affirms the allegation that there was ineffective communication of the risk strategy to all officials in the employ of the hospital. And Dr. Matebula, the CEO, also conceded that the communication lines could have been more effective. There is no evidence at the Public Protector's disposal that there is provision of inappropriate PPE, as the distribution of the PPE is in line with its purpose. The reuse and redistribution of the cleaned and sanitized PPE is in compliance with version 2 of the COVID-19 disease infection prevention and control guidelines. Therefore, this office could not find any wrongdoing with the reuse of the PPE by the hospital. The hospital complied with the registration and declaration of donations in the donations register. Moving over to the Chris Hani Paraguay Academic Hospital, evidence in our possession revealed systemic deficiencies such as broken taps in the kitchen, the ablution facilities in Ward 59, which was also broken, however, have since been repaired. There was an undue delay in the filling of vacant positions as a result of the late creation of positions. The porters were unavailable at their workstations in the hospital to assist with the movement of patients to various wards within the hospital. However, additional porters have since been appointed. The Baragwanath Hospital has human resources capacity constraints, challenges, and as a result cannot handle the influx of patients at the hospital, which is said to be a historical challenge. Delays in the distribution of PPE, that is, in stock of the non-sterile gowns, albeit temporary. The COVID-19 disease infection prevention and control guidelines version 2, dated 21 May 2020, permits the reuse or redistribution of cleaned and sanitized PPE. Therefore, the public protector could not find wrongdoing with the reuse of the PPE by the hospital. Contrary to the allegation that critical or emergency surgeries were deferred, it was established that after the first wave, the surgical services were fully restored. The evidence in the public protector's possession shows a current theatre list which indicates that surgeries are still being conducted. Elective surgeries were deferred for patient safety as they are not life-threatening, and the public protector found that the explanation was reasonable under the circumstances. There was no dedicated ward, no specialized ward to house COVID-19 psychiatric patients, which meant that in the event patient tested positive, there would be no ward to accommodate them. It is established that there were challenges with centralization of the procurement of PPE as shown by the delays in the supply and delivery of the PPEs at this hospital. The Lilian Ngoyi Community Health Care Center, evidence obtained reveals systemic deficiencies at the center, such as lack of hot water in the labor ward. Broken geysers and heaters were observed at the facility. However, new geysers and heaters have since been installed at the facility after the intervention of the Office of the Public Protector in August 2020, as shown by evidence. The allegations that the ICT infrastructure, such as telephone lines, were not working is substantiated. However, Lilian Ngoyi Hospital has remedied the above on the 17th of August 2020, when the telephone lines were installed and the landline was operational as of the 28th of October 2020. A cellular phone with 400 Rand airtime is now being used as a backup to the landline. The photocopier, which were also not functional, has since been replaced as of the 10th of December 2020. Evidence and observations made during the inspection in Loco by the Public Protector revealed systemic deficiencies in that there is an undue delay in filling various posts, including the facility manager's post at the Lilian Ngoyi Community Center. However, the position of the facility manager was advertised, but a suitable candidate could not be found. As a result, the post has since been re-advertised. Mr. Malotana and Mrs. Murewane conceded that there was dirty linen on the beds, but a supervisor has been assigned to oversee and manage linen. It was further observed during our on-site inspection that patients waited for over 3 hours to be attended to by the doctors. After the on-site inspection, the Chief Medical Officer, Dr. Reis, is monitoring the doctors as per allocation in order to avoid patients having to wait for long periods before they are being attended to. The evidence at our disposal indicates that the allegation that there was a lack of nutritional food available for patients who stayed overnight at the center was substantiated. However, subsequent to the intervention by the Public Protector, there is sufficient provisioning of food and served to patients that are admitted to the facility overnight. Mr. Molotana and Mrs. Mkhwebane conceded there was a lack of a risk management committee and occupational health and safety committee at Limbo. There is no evidence that the donations received by the community center hospital from Nova were registered and declared in line with the National Treasury regulations. Charlotte Mkhwebane, Johannesburg Academic Hospital, evidence and observations were made during the on-site inspection by the Public Protector and the team revealed systemic deficiencies such as delay in the creation of positions and filling of positions. There were delays in the distribution of PPE, and some of the PPE was of poor quality, which had to be returned to the depot, as it was not as per the specifications. Mr. Molotana conceded that initially there were delays in the supply of the PPE and distribution of the PPE, but those were corrected. And although some of the PPE was of inferior quality, not all PPE procured was of substandard. There was a lack of medical soap and scrub, and the staff had to use green soap. This was not disputed by the hospital. There were delays in the procurement of and maintenance of medical equipment despite requests being made to the provincial department. There is no dedicated ward to accommodate psychiatric patients at Charlotte Mkhwebane, as it was observed during the site visit that the psychiatric patients were accommodated in an open space. It was established that the delays in the procurement of medical equipment was as a result of limited delegation to the CEO, as well as centralization of procurement and the ineffective SCM unit within the department. There were delays in the storage, collection, and disposal of medical waste at the hospital as a result of poor performance by the service provider. There was a lack of contract management in respect of waste disposal, which likely resulted in the service provider benefiting for 4 years without a competitive process being undertaken. The linen was not checked for sharp objects before being sent to the laundry room, and this has a potential to cause harm to the staff in the laundry room. Contrary to the allegation that staff were not allowed to apply for special leave, it was evident that staff members applied for special leave, and the said applications were processed as shown in the evidence in the report. It was established by the investigation team that there were challenges with centralization of procurement of PPE, as shown by the delays in the supply and delivery of the PPE. Based on the evidence in the Public Protector's possession and the submissions made by the management at all 6 hospitals, the Public Protector found that the Provincial Department of Health experienced systemic challenges which impacted on the healthcare services being delivered to the public. Failure by the department to comply with standards set by law amounts to contravention of Section 195, subsection 1B, E, and H of the Constitution, Sections 237 of the Constitution, and Section 27, subsection 1A, and subsection 2 of the Constitution, Regulation 8, subsection 1, subsection 2, subsection C, D of the National Health Care Act, Section 13, subsection 1, subsection 2, A, B of the National Health Act, Regulation 16, subsection 1, subsection 2, subsection A, subsection B of the National Treasury 21 May 2020 regulation, amongst other prescripts. The appropriate remedial actions were taken in pursuit of Section 182, subsection 1C of the Constitution is the following. The acting HOD of the Provincial Department of Health must take appropriate steps to measure that within 60 days of issuing this report, the Supply Chain Management Unit is reassessed to determine if it has the capacity and capability to respond to the procurement needs of the hospitals within the province. Upon completing the diagnosis, to implement appropriate measures that will resolve the challenges within the system. undertake a diagnostic exercise to determine what is causing the delays within the supply chain management processes with regard to procuring, maintaining, and delivering medical equipment to the hospitals within the province as per the demand and maintenance plan. Upon completing that diagnostic, to implement appropriate measures that will resolve the challenges within the system. Implement quality assurance measures and mechanisms to guard against the provisioning of substandard items. The department, in collaboration with the Gauteng Department of E-Government, must ensure that they prevent delays in the late creation of positions at the different hospitals, especially in the midst of a pandemic. Ensure that an independent review is conducted of Lilian risk management function and to advise on the applicable standards and risk management legislative framework. Draft a monitoring tool that will ensure that staff receive in-service training on infection prevention and control every 2 years. Draft a monitoring tool that will ensure health risk care waste is managed appropriately. Consider reviewing the delegation of authority in respect of the respective CEOs and implementation of the decentralized SCM policy as envisaged. Submit and implement report in respect of the remedial action. In respect of the Jubilee Hospital, Dr. Sibongile Zungu, the acting head of the Provincial Department of Health, to take appropriate steps to ensure that within 30 working days that there is compliance with testing around times of specimen as prescribed in the Ideal Clinic Manual version 19 on page 286. In the event that the hospital is allocated high volume of goods and the dedicated vehicle does not have the necessary capacity, provide additional fleet vehicles from the department. Consider having an alternative building technology structure to cater for the staff members during their lunch breaks for the duration of the COVID-19 pandemic. Within the 2021-2022 MTF, the department, and where appropriate in consultation with the DID as well as Gauteng Provincial Treasury, conduct a full conditional assessment of the hospital buildings in order to develop a cost-based strategy for planning and budget allocation over the MTF for refurbishment of the facility subject to budget availability. In the respect of the Dr. George Mokari Academic Hospital, the HOD of the province is required to take appropriate steps to ensure that within 30 working days, within the 2021-2022 MTF, the department, and where appropriate in consultation with the DID as well as the Gauteng Provincial Treasury, that there is a designated medical waste storage space which is duly ventilated, has a lockable door to ensure controlled access, has clearly marked biohazardous signage in the space, not exposed to direct sunlight, and has a specific person in charge of the storage space with available contact details. Within the 2021-2022 MTF, the Gauteng Department of Health, and where appropriate in consultation with the DID as well as the Gauteng Provincial Treasury, conducts a full conditional assessment of the hospital buildings in order to develop a cost-based strategy for planning and budget allocation over the MTF for refurbishment of the facility subject to budget availability. Ensure that there is a regular collection of biohazardous waste with an adjustable roster depending on the generated waste that has clear timelines. Consider taking disciplinary steps against those officials responsible for the late payment of contract health workers as well as the appointment of staff before positions were created. Ensure that the hospital complies with Section 38, subsection 1A1 of the PFMA and convenes regular risk management meetings, more so during a pandemic, in order to prepare for and mitigate emerging risks. In respect of the Steve Biko Academic Hospital, within the 2021-2022 MTF, the department, and where appropriate in consultation with the DID as well as Gauteng Provincial Treasury, implement the recommendations of the full conditional assessment of the hospital in respect of the roof repairs in order to develop a cost-based strategy for planning and budget allocation over the MTF for refurbishment of the facility subject to budgetary availability. that the hospital complies with Section 38, subsection 1A1 of the PFMA and convenes regular risk management meetings, more so during a pandemic, in order to prepare for and mitigate emerging risks. Consider formulating a risk management committee that is comprised of both management and external members with the necessary blend of skills, competencies, and attributes in order to ensure that is effective and efficient risk management and internal control as envisaged by the PFMA. It is advised that the chairperson of the Risk Management Committee is an external person as recommended by Chapter 13, subsection 24.3 of the Public Sector Management Framework to ensure independence and objectivity. In respect of the Paraguay Academic Hospital, for the duration of the COVID-19 pandemic, the ambulances are disinfected after the delivery of every patient by way of a fogging machine or other fast and effective disinfecting methods. It is considered crucial that the hospital continues to clean ambulances after every 12-hour shift. Within the 2021-2022 MTF, the department, and where appropriate in consultation with the DID, as well as Gauteng Provincial Treasury, consider identifying a dedicated ward for COVID-19 positive psychiatric patients in order to develop a cost-based strategy for planning and budget allocation over the MTEF for accommodation of psychiatric patients at the facility, subject to budgetary availability. Ensure there are sufficient porters available at the hospital to assist in the movement of patients to various wards within the hospital and refrain from allowing untrained family members to escort patients. Ensure that the human resource capacity challenges at the hospital is resolved amicably and in line with the Ideal Hospital Framework, Ideal Hospital Assessment Tool, Ideal Clinic Framework, and Ideal Clinic Manual. Conduct a work-study investigation which will assist in the identification and resolution of challenges to human resource capacity at the Paraguay Hospital. In respect of the Lilian Goyu Community Center, that the HOD within 30 working days ensure that there are enough doctors on duties to provide medical care to the patients and have a dedicated roster to monitor adherence to the facility's prescribed waiting times in line with the Ideal Clinic Framework version 19 of April 2020. Ensure that a risk management committee is established and a risk assessment of the Lilian Goyu Community Healthcare Center is conducted with immediate effect, following which regular risk assessments have to be conducted. Ensure that all gifts, donations, and sponsorship received during the course of a financial year be disclosed as a note in the annual financial statements of the Lilian Goyu Community Health Center. Ensure that a suitable candidate for the position of the facility manager is appointed. In respect of the Charlotte Maxake Academic Hospital, the HOD to ensure within 30 working days that all staff check and verify that laundry or linen from the wards do not have sharp objects such as surgical instruments that might be contaminated before it is submitted to the laundry section, thereby putting laundry staff at risk of infections or harm. Within the 2021-2022 MTF, the department, and where appropriate in consultation with DID, as well as Gauteng Provincial Treasury, to ensure that there is a designated medical waste storage space which is duly ventilated, has a lockable door to ensure controlled access, has clearly marked biohazardous signage in that space, not exposed to direct sunlight, and has a specific person in charge of the storage space with available contact details. Ensure that there is a regular collection of biohazardous waste with an adjustable roster, depending on the generated waste that has clear timelines. Ensure that there is a dedicated vehicle to collect goods such as PPE, and in the event that the hospital is allocated high volumes, additional fleet may be requested from the Gauteng Department of Health. Allocated vehicles to Charlotte Maxake Hospital to address its needs and transport challenges. Within the 2021-2022 MTF, the Gauteng Department of Health, and where appropriate in consultation with the DID, as well as the Provincial Treasury, consider identifying a dedicated ward for psychiatric patients in order to develop a cost-based strategy for planning and budget allocated over the MTF for accommodation of psychiatric patients as the facility subject to budget availability. The HOD of the Gauteng Department of Infrastructure Development must take appropriate steps to ensure that within 60 days of the date of this report, provide a report of the maintenance plan of the hospitals mentioned in this report, detailing how often they have been maintained and what has been repaired to date. Within 60 working days of the date of this report, provide a report in respect of the planned construction, upgrade and maintenance of health facilities mentioned in this report, and when will that be implemented. Within 30 working days of the issuing of this report, indicate which projects of the facilities infrastructure management unit is working on that relates to the healthcare facilities. I thank you. I hand back to the Public Protector.
Thank you, DPP. We now deal with Mpumalanga Department of Health. We investigated allegations of poor conditions at the Temba Hospital in Kabokweni, Mpumalanga. Following a visit to this hospital on the 4th of September 2020, we took the initiative in terms of Section 6.4 of the Public Protector Act to conduct an in-depth investigation into the observations made and challenges raised by the hospital management, the representatives from the organized labor and staff. The investigation sought to examine a number of factors, including the availability of healthcare, human resources, physical infrastructure, and vital equipment, machinery, personal protective equipment, and staff morale in the light of the strain added by the outbreak of COVID-19 pandemic. On the basis of the available information and observations made during the visit, the investigation focused on whether the administration of health by the Mpumalanga Department of Health at the hospital accords with the obligations imposed by the Constitution and the law, and if not, whether such failure amounts to improper conduct and maladministration. The investigation revealed that the administration of health by the department at the Temba Hospital does not accord with the obligations imposed by the Constitution and the law. Observations made during the engagement with hospital management and organized labor, as well as the on-site inspection, revealed systemic deficiencies such as staff shortages, lack of adequate space, deplorable maternity ward conditions, shortage of medical equipment, insufficient supply of personal protective equipment, poor physical infrastructure such as dilapidated buildings, lack of maintenance of laundry services, and non-functional cooling system at the X-ray building. Proper maintenance and repair of the laundry machines will assist in alleviating the shortage of clean linen to a certain extent. Unfortunately, Marava Building and Civil JV, the service provider appointed for the maintenance and repairs of the laundry machines, does not have the capacity to fix their machines. The lack of capacity by the service provider has come to a huge cost to the hospital. However, the Provincial Department of Public Works and Roads and Transport concluded in its response to a Section 7.9 notice issued by the Public Protector that the Provincial Department of Health has not reported the poor performance by the service provider in writing, though then the provincial hospital was indicating that they've done that telephonically. So you could see then the lack of cooperative governance in the province, which has serious detriment to the livelihood or the lives of the people. So the Provincial Department of Health then confirmed when our officials went back to assess the situation that they are waiting for the Department of Public Works to do that, because already they've done the request or they've complained in writing, and the Department of Public Works promised to appoint a service provider as an implementing agent by the end of September. So we'll have to follow up whether that has been done. The hospital is experiencing a general shortage of staff, and when we visited in last year, September, the facility was still awaiting the appointment of the professional nurses who could be utilized in the intensive care and trauma units and other units. So the department was expected to employ 23 professional nurses for that district. So I can confirm that through our intervention, the hospital has appointed 23 professional nurses. 16 of them were appointed at Temba Hospital, while the other 7 have been appointed at Rob Ferreira Hospital. Specialists such as 2 obstetrics and gynecology, a head of the pediatric department, and a general surgeon have been appointed. The hospital organogram for medical specialists provides for 28 posts, but then only 11 are filled, and this means that there are 17 vacancies, which is 61% vacancy rate in respect of medical specialists. The department's practice that provides that if the recruitment process is not finalized within a period of 3 months, the hospital loses the post because it would no longer be funded, is very detrimental to the hospital and perpetuates the prejudice that the hospital suffers as a result of the shortage of staff and loss of budget to fill those vacant posts. However, the department has since introduced the e-recruitment system, which is fast-tracking the appointment process. The system can do profiling of applications, which was time-consuming when there was a high volume of applications. That notwithstanding, this e-recruitment system is not included in the department's recruitment and selection policy. So the hospital did not receive all the requested COVID-19 life-saving equipment such as ECG, blood pressure monitors, ventilators, ICU beds, incubators, ventilators for adults, etc. The hospital was not designated as the COVID-19 center, and the hospital's corporate services manager, who had not been stationed at the facility for almost a year due to a labor dispute, which resulted in him being transferred on a precautionary basis to head office, passed on in February 2021. So the continued absence of the incumbent in that position is worsening the shortage of staff and compromising proper administration of the hospital. The current maternity ward is in a deplorable state, and the patient's rights are violated. There is not enough space, as there are only 2 delivery beds, no privacy, no decent waiting area, and there is shortage of staff despite the fact that the hospital delivers 15 to 18 babies per day. We, however, take cognizance of the impending project and interim measures as confirmed by both the Provincial Department of Health and Public Works, Roads and Transport in their responses to the Section 7-9 notices dated March and June respectively this year. They indicated that in their planning and design for the proposed construction of the new maternity ward, has been the planning and design has been completed, and the project was planned to start in the second quarter of 2021-2022, which should have started in June already, and they estimate to take 36 months to complete. In the meantime, the Provincial Department of Health plans to construct a 23-bed alternative build technology (ABT) structure to house lodger mothers, upgrade the existing maternity ward with provision of privacy between patients, provision for new bulk storage facilities, upgrades to the children's ward, raise specialty OPD, and upgrade the section to another new ABT structure. The vacated ward would then provide space for the maternity section, providing an extra 46 beds. The work will be done by 2 contractors, and the first contractor, Kuno Trading, will complete its part and then hand over the site to the new contractor by end of September 2021, which was yesterday. We will have to go back and see whether that has been done. So the hospital has infrastructure challenges due to its age as it was built in 1974 and lacks proper maintenance. This is hampering and limiting the hospital from rendering proper and adequate services to the community. However, the department has since developed a maintenance plan to deal with infrastructure challenges, but this plan cannot be implemented due to financial constraints. The allied health services that include occupational health and psychology, amongst others, are provided in a ward that is not suitable. For instance, 4 doctors share a consulting room. At the same time, patients are examined in front of others. That violates their right to privacy. However, it is encouraging to note that the department has identified suitable areas to be allocated to the relevant allied services upon completion. These areas are Bambanani Wellness Clinic, Tutuzela counseling rooms, and prefabricated rooms for male circumcision. The issue of general maintenance or lack thereof in the hospital is exacerbated by the capacity constraint. The maintenance plan developed by the department to deal with infrastructure challenges cannot be fully implemented due to financial constraints, as confirmed by the department in responding to our Section 79 notice. The organogram for the hospital was approved in 2010 and reviewed in 2019 based on the budget allocation, and it is not outdated as alleged by the unions. It therefore includes or caters for the new services being rendered, such as Bambanani Wellness Clinic, which is mainly for HIV and AIDS patients, a new general ward, and a clinical engineer workshop. It is submitted therefore that the failures as indicated above by the department amounts to contravention of the Constitution, which is Section 195 of the Constitution and Section 237 of the Constitution, Section 27 subsection 1 and Section 25 subsection 1 and 2 of the National Health Act, read with the various sections of the norms and standard regulations issued as per Government Gazette 67 number 41419 of 2 February 2018. So the conduct of the department accordingly constitute improper conduct as envisaged in the Constitution, and maladministration as envisaged in the Public Protector Act. We note and acknowledge the challenges and constraints faced by the department, such as budgetary constraints that may hamper its implementation of the maintenance plan on infrastructure challenges and the implementation of human resource plan, as well as the context within which health services are delivered at the hospital. Based on the plans submitted by the department, detailing how the shortcomings and deficiencies at the hospital will be addressed, and taking into consideration submissions made by both the Provincial Department of Public Works, Roads, Transport and Treasury, the appropriate remedial action that we are taking in pursuit of Section 182(1)(c) of the Constitution is as follows. Within the 2022-2023 medium-term expenditure framework, the Provincial Department of Health, and where appropriate in consultation with the Provincial Department of Public Works, Roads, Transport and Treasury, finalizes the following projects: implement the maintenance plan for the repairs and maintenance of the laundry machines and the X-ray building, relocate the allied services to the identified areas which are to be made suitable at the Bambanani Wellness Clinic, to Tutuzela counseling rooms and prefabricated counseling rooms, and addressing shortages in human resources by filling vacant and critical positions. The department must also ensure that additional and sufficient PPE for the hospital is procured within 30 working days from the date of this report. The building of the maternity ward is adequately budgeted for in the next 3 financial years, and if that is done, the project will then be complete in that particular period. The recruitment process for the vacant position of corporate services manager at the hospital is finalized within 90 working days from the date of this report, and the filling of the critical positions, including leadership positions at the hospital. And it must further ensure that the relevant treasury is engaged for additional funds to fill the vacant and critical positions, and to construct psychiatric wards at various district hospitals on a short-term basis, and to construct a psychiatric hospital in Mpumalanga on a long-term basis. Within 2022-2023 MTF, the department must, where appropriate, consult with the Department of Public Works, Roads and Transport, and conduct a full assessment of the hospital buildings in order to develop a strategy for planning and budget allocation over the MTF for refurbishment of the facility, subject to budget availability. The department must prepare and submit a proper business case to the provincial treasury. The e-recruitment system must be included in the department's recruitment and selection policy as part of their recruitment process. In addition, the health department, the head of the provincial Department of Public Works, Roads and Transport must ensure that the department provides technical infrastructure support and renovation needs where it is necessary, including maintenance of laundry machines, cooling system in the X-ray building, and in relation to the hospital and other public health facilities. The head of the provincial treasury must provide financial support and oversight where necessary in order for the hospital and provincial Department of Public Works, Road and Transport to address the service delivery challenges. Further, the head of provincial treasury must allocate budget to other public health facilities that may be affected in the province of Mpumalanga. Then we issued a report also relating to the Limpopo Health Department, where we visited WF Nobel Hospital outside Bulukwane, I think near Mulechi. And that hospital, the locals are calling it Aubui. It means once you are admitted there, you will never come back home because a lot of people are dying in that hospital. So we visited the hospital and we also identified various gaps in that particular hospital. And what we've seen as well relates to, or our investigations include the availability of healthcare services, human resource, physical infrastructure, and vital equipment, machinery, no protective personal protective equipment, staff morale is low. And a site inspection was conducted on the 1st of September 2020, and out of the site inspection, then we identified various service failures. So having considered the evidence and information obtained during the investigation against the relevant regulatory framework, we found that the administration of the hospital by the department did not accord with the obligations imposed by the Constitution and the law at the time of the inspections. The observations made during the inspection revealed some deficiencies such as staff shortages, lack of medical equipment, poor physical infrastructure such as dilapidated buildings, leaking water and steam pipes, poor condition of COVID-19 ward. I mean, these were detailed in the evidence obtained during the inspection. One COVID-19 ward being shared by various patients, those who are still going to be tested and those who are positive, no ablution facilities. It was a horrible experience to go through. However, the department subsequently attended to and rectified the majority of the identified deficiencies through our intervention. This was done prior to the department's response to the Section 79 notice. So the deficiencies had also been echoed in the presentation by the hospital's own management and in submissions made by the union representatives who were engaged during the interaction. So despite the departments disputing some of the observations we made in response to their Section 79, the said observations painted a picture of a facility not in keeping with the requirements for the provision of health services as required by the law and prescripts. Therefore, they've also failed or they've contravened the Constitution, Section 195, 237, Section 27.1 and 25.1 and 2 of the National Health Act, as well as the regulations. So the conduct of the department also violated the Section 182 of the Constitution, because that constituted improper conduct and maladministration in terms of the Public Protector Act. So the investigation team made a follow-up visit to the hospital in May 2021, and the team conducted a review interview with the CEO of the hospital, who was not there when we visited the hospital, but this time they managed to engage him. So it transpired that in the intervening period between our inspection 1 September 2020 and the subsequent visit by the investigation team 18 May 2021, almost all the deficiencies that had been raised in the Section 79 notice had been attended to. So it's through our intervention, and the deficiencies that were addressed include staff shortages, lack of adequate medical equipment, the X-ray room, poor standard of PPE, poor physical infrastructure, such as dilapidated buildings, lack of laundry services, state of the COVID-19 ward, and liquid leakages. The report has full details in this regard. So we came to the conclusion that with regard to appropriate remedial action, the department must take appropriate steps to ensure that within the 2021-2022 MTEF, the department, and where appropriate in consultation with the provincial departments, I think it should be within the 2022-2023 MTEF. We'll have to correct that. The department must make sure that they finalize, complete the relocation of the X-ray room, complete the establishment of the laundry sorting area, continuation of the infrastructure renewal program, routine maintenance of the hospital premises and the grounds, address labor relations matters between management and staff to create a conducive and a healthy working relationship, because once that is created, at least the staff will be able to treat the patients with respect and with love, because they are also working in a very conducive environment. Continue providing sufficient quality PPE. Finalize the filling of critical posts within 90 days. Procure medical equipment required to provide healthcare services for the level of services required at the hospital. So we refer this matter to the head of the Provincial Department of Public Works, Roads and Infrastructure for consideration of technical infrastructure support and renovation needs where it appears necessary in relation to the identified and other public health facilities in the province. The matter is further referred to the head of the Provincial Treasury to also consider financial support and oversight where it appears necessary in relation to the identified and other public health facilities in the provinces. So I must indicate that these reports will be shared with the Minister of Health, the Minister of in the Presidency, the Director General for Health, Dr. Sandile Buthelezi, in fact now whoever is acting, and the Director General in the Presidency, and the respective premiers of the affected provinces, the respective MECs, and the HODs of Health, Public Works, Roads and Infrastructure and Finance in the affected provinces. They normally say those who have ears will hear, those who have eyes will see. Therefore, for them to be efficient, they'll have to use these reports as a starting point to deliver to various citizens. So I must say that it warms my heart that some authorities have considered to most, if not all, the deficiencies that we have picked up during the inspections and investigations. Above all, undertakings have been made to make amends, and in some instances the implementation of remedies are underway. We would like to thank all those officials and the investigation teams who've interacted with our staff during the process. Without their cooperation, we would not have been able to complete these investigations, all of which took under a year to finalize. So we look forward to the implementation of these remedies for betterment of the lives of the grassroots communities. I think there's still a lot to be done under the COVID-19 challenges, where a lot of provinces are still not up to scratch, and it's a very concerning state of affairs, considering that we have the National Health Insurance, which is supposed to be implemented, and we are still supposed to make sure that all these are improved for the benefit of the public. Thank you, Program Director.
Thank you so much, Public Protector and Deputy Public Protector. We will now take questions. I have received a few via WhatsApp. I don't know if Kaya there has a question. We can start with him before we go to those that are coming through the wires. Go ahead, sir.
Hi, good afternoon. It's Kaya Kumara here from ENCA. So thank you so much for that comprehensive report. I mean, these are some of the issues that are, quite known for some time. What has been the response, for example, from the provincial departments, especially because we find ourselves in a very precarious position where we have this particular pandemic? Surely these are some of the issues that could have been addressed for some time. So what's the plan now in terms of making sure that they deal with these issues? Thank you.
Thank you, sir. Perhaps let's take one more question, Public Protector and Deputy Public Protector, if you may. This one comes from Molemo Motwa from the SABC. She asks, is there a time frame on when the implementation of the remedies should be completed? I repeat the question, is there a time frame on when the implementation of the remedies should be completed? I will follow shortly with other questions.
Thank you for the questions. ENCA, it's when we visited last year, September 2020, as we've indicated in the various reports, we found those deplorable state of affairs in the various hospitals. But then, since you know that myself and Deputy Public Protector, in fact, the Public Protector delegate the investigation powers to investigators. So therefore, our provincial investigators and the provincial reps had to go conduct investigations, visit those hospitals. So I must indicate that we've mentioned here that most of the hospitals, after our visit, after our engagements with them, they improved a number of issues in the various hospitals. As we've indicated that in the Mpumalanga area, there were professional nurse positions which were supposed to be filled. I mean, there was 23 which have been filled already, 16 of which were deployed at the Mpumalanga Hospital. We found that in the Limbo Hospital, a lot of changes have been made, and there's a lot of promises which they are making. But remember, we have the time frames, maybe going to the questions, that how long will that take? As you've seen, we are saying within the 2022-2023 MTF period, they need to make sure that all these issues are addressed, because again, it goes with the budget. We don't want, as the Public Protector, to come and impose remedies which are not implementable. And in this process, I must indicate that we were working with the various departments and various hospitals to make sure that they understand why we are doing this and how they can improve these situations. I mean, where they've introduced e-recruitment policy or system, and we are saying for you to be compliant as well to the when you are being audited by the Auditor General, make sure that you include that in your policies. And we are also have seen that the alternative build technology, because they are quick to build. I think that's also a way to go, especially in Mpumalanga, to increase the ward. And it was a very terrible situation to experience. I think DPP, you can add what you'd want to add on the hospitals which you also took us through. Whether is there anything which is coming up which you feel that at least has been addressed, because that's what has happened. They've submitted the implementation plans and they've started implementing through our intervention.
Thank you, Public Protector. Indeed, the facilities in the department, even before the issuance of the final report of the Public Protector, had already started with the turnaround in respect of remedying the deficiencies that we had identified. For instance, at Limbo, the state of affairs at which we found the mothers and the children, the babies going through, by the time the team went there for the second time, it had changed. They had access to warm food and warm water and a warm environment, which they did not have access to. And the repairs had been done. As well as at the Chris Hani Baragwanath Hospital, there were some of the implementations that were done. For instance, the consultations were in much of a better position. And we are still yet to receive Public Protector the implementation of the rest of the remedial action, as the remedial actions state that we are giving these departments 60 working days to provide us with a full plan of their implementation plan. KwaZulu-Natal has already provided in respect of the turnarounds that they are doing as a province. Thank you.
Thank you.
Thank you, VP and DPP. I have 4 questions here now from Newsroom Africa. The first is this. What happens if clinics such as Lilian Ngoyi are not able to add to their staff complement? For example, doctors as ordered, because we've been hearing of budget constraints. What happens then? That is Bongiwe Zwane from Newsroom Africa. She also asks, what reasons were given by Steve Biko Academic Hospital Management for not holding meetings regularly? She further asks, what becomes the role of the health department here? Because clearly these facilities are struggling. I think that question is linked to the previous one about failure to hold regular meetings. And then lastly, she asks, the COO says that his tenure at the PP's office is one that he would rather forget. What does the PP say to this? Has the COO explained in his letter why he left? Those are the questions from Newsroom Africa, I'm sorry. And then I have one here from Netwerk 24 from Mr. Llewellyn Prince. He asks, does the Office of the Public Protector have any pending investigations regarding the digital vibes matter or against Dr. Zweli Mkhize, the former Minister of Health? And secondly, does the Public Protector have any comment for us on this matter, as it also pertains to the misappropriation of public funds in the midst of a worldwide pandemic? That's Mr. Llewellyn Prince from Netwerk 24. Thank you.
Okay, Bongiwe and newsroom viewers and listeners. What happens when there cannot be more space available for the doctors at Lilian Ngoyi? I think what we said in our investigation and in the report, or the remedies which we've provided there, we said since there are not enough doctors on duty to provide medical care to patients and they need to have a dedicated roster to monitor adherence to the facility's prescribed waiting times in line with the ideal clinic framework version, and we've told them which provisions or which framework they can utilize because it's there. And then also they need to ensure that their risk management committee is established and a risk assessment of Lilian Ngoyi Community Center is conducted regularly. So if they have a roster where they have the doctors, there won't then be a need for them to create additional infrastructure. But as you've heard, we were saying what we've seen at Jubilee, that those alternative built infrastructure, at least they are quick to build. And we've recommended, like in Mpumalanga, to build those for the mothers after giving birth. At least they can be moved there, as well as in Lilian Ngoyi. I mean, they can have structures like those, and especially to make sure that more patients can be seen, more beds are created, or more consulting rooms are created. So those alternative built infrastructure, they are not expensive as the your brick and mortar. And brick and mortar, you know that it will take ages. So I think during this particular time, the health MECs, health HODs should now be doing things innovatively and out of the box. So meetings at the Steve Biko Hospital, I think that has to do as well with the issue of leadership, especially the CEO of the hospital, who is said not to be conducting those. And those are the management competencies, which we have also made recommendations as far as those are concerned. So we indicated that the CEO of the hospital should, because you'd find that there are those risk management committees, and the CEO as the accounting officer will have to make sure that they are compliant too. I will request DPP if you can chip in there and indicate what remedy we gave as far as the Steve Biko is concerned, considering the fact that that has an impact on the delivery of services, or the hospital is struggling in that particular aspect. Maybe you can deal with that, and then we'll hand over to CEO to deal with the COO matter, because she is the one who received the resignation letter, and would then take us through that. And then also the issue of the digital vibes I'll address after. GPP?
Thank you. Thank you, Public Protector. I'm just trying to get to the actual legal action.
Steve Biko.
Yeah, Steve Biko.
Okay, maybe while still looking, CEO, why did, do you have any idea why that?
I can only say that the COO did not provide any reasons. His resignation letter was very brief. He just indicated that he wishes to be released from his responsibilities with immediate effect. When I asked him, he said he took a decision after he had a discussion with his family. So resignation is a personal choice. Unfortunately, I couldn't probe further what the discussion was between himself and his family. So I had to release him as requested. Thank you.
Thank you, CEO. DPP?
Thank you, Public Protector. The remedial action that we've taken in respect of Steve Biko is to really ensure that the hospital complies with Section 38, subsection 1A1 of the PFMA, and convenes regular risk management meetings, more so because of the pandemic, in order to prepare for and mitigate the emerging risks. Further, that they consider formulating a risk management committee that is comprised of both management and external members, with the necessary blend of skills, competencies, and attributes in order to ensure that is efficient and effective risk management and internal control as envisaged by the PFMA. It is also a remedial action that the Public Protector took and advised them to that they get an external chairperson of the risk management committee as recommended by Chapter 13, subsection 24.3 of the Public Sector Management Framework to ensure independence and objectivity.
Thank you, DPP. I'll also put CEO on the spot because I know she's passionate about risk management and how can this help the hospital, because I think these reports are meant to be a tool for the leadership of hospitals, the MECs, the HODs, to learn from and improve on how they need to be managing their institutions.
I think there's still a bit of lack of understanding of risk management, especially within the government sector, because people do not see the value that they can derive from managing the risk. So most institutions do risk management as a compliance issue because it's prescribed now in terms of the treasury regulations as well as the framework. But it's a question of, it's important to manage your risk, because if you manage your risk, you know what you can expect. You are not taken by surprise at any given time. And that's why this was prescribed as part of the disaster management regulations issued by the Department of Labor and Employment, because there was a need for us as institutions, including hospitals, to identify the risks that can probably contribute towards the spread of the coronavirus. But unfortunately, it seems as if people were caught off guard because most institutions were not ready. That's why then they failed to put the risk management processes in place. But I would really encourage every government institution not only manage the risk in terms of the pandemic, but just continuous management of risk. Because if you manage your risk, you know exactly what confronts you, and you start putting systems in place to make sure that you can achieve your objectives. Most institutions fail, not because they don't have qualified people, they don't have budgets, but they fail because they fail to manage their risk. They fail to anticipate what can go wrong so that they can start implementing measures to prevent that from happening. And that's something that I would really encourage everybody, especially our health institutions, because if you do not manage your risk, as DPP and PP mentioned when they presented, that in some instances they find the laundry that was transferred to the laundry, the dirty laundry that was transferred to laundry for services to be provided there, but it still had particles, probably used needles and all that. That's a biggest risk, because you could be further transmitting other diseases through that. But if you do your risk management, then you will identify that as a risk. Then you'll put a system in place that makes sure that you check your laundry properly before you transfer it somewhere else, so that you do not take the diseases or the infection from one ward to the laundry services and find that everybody eventually is infected because of this one needle that was part of the laundry. So risk management becomes key to everybody, even beyond the pandemic itself. Thank you.
I knew that she will go on and on. She loves risk management. So all the digital vibes, we haven't received any complaint on the matter. And I said several times that, own initiative investigations, we conduct them based on our available resources. The health, own initiative investigations, and the school's own initiative investigations we conducted, it was because of the pandemic and the disaster and how we can intervene as an institution. This one of the digital vibes is also very critical, since there was no complaint which was lodged. And in terms of the Executive Members Ethics Act, I cannot conduct an own initiative in that respect. And it's good that the SIU has investigated the matter, has made some recommendations. And I must indicate that SIU, when they conduct their investigations, they work very closely with the other law enforcement institutions, like your Asset Forfeiture Unit, your NPA, the police. So I hope that whatever evidence they've acquired, they've handed over to them, and the criminal investigation will be conducted. But I think it's very, very, very concerning and disappointing to hear that the former Minister of Health, who should have been without any or should have managed the process and during the disaster which we were facing as a country, as indicated, would also be implicated in such incidences of abusing state resources and not following processes and violating the Constitution, which is very critical for him to even oversee in making sure that whatever resources is there is utilized for the benefit of the South Africans. Considering the state of health facilities in the country is deplorable, I must indicate. Our people are facing a very serious uphill, and we are pleading with government to use these reports as a starting point. At least it will change lives of South Africans. Thank you.
Thank you, Public Protector, Deputy Public Protector and CEO. Some of the colleagues on the wire are saying, I forgot to introduce the panelists because they want to quote the CEO. Her name is Ms. Stanley Sibanyoni. Thank you so much. I don't think we have any more questions. So at this juncture, I would propose propose that we adjourn.
Thank you.
Thank you.
Thank you.
Thank you, Mr. Safari.
Yes, a lecture on risk management. Yeah. Everybody, when you retire, you must go to government summit. We used to call
I'm
it.
passionate about it.
Yeah. Basta kung sa CEO, kasi it's a personal issue. Thank you so much, Chef. Ngifundise.
But I'm not like, I just